Well, hello and welcome everybody joining us today to one more Red Dot Cafe. We hope this live stream series is adding value and inspiration to your daily life. I'm Alberto Garcia Jurado, a TEDx speaker and part of the TEDx San Antonio programming committee. Now, in today's conversation, we want everybody to join in and be part. So please leave your questions and comments in the feed, and we'll be dedicating some time during and at the end of the session to so our two wonderful guest speakers can respond and or comment. And today, I'm really happy to be joined by two fellow TEDx speakers, Dr. Jason Rosenfeld, Assistant Professor of Medicine, Research and Assistant Director of Global Health Center for Medical Humanities and Ethics at UT Health San Antonio. He's a 2016 TEDx speaker who shared on building community and unity one club at a time. Dr. Rosenfeld, thank you for joining us, Jason.
Good to be here. Thanks for having me.
Yes, and our other wonderful guest speaker is Myric Polhemus. He's the Director of Talent Development at HEB. And if you're Texan, HEB needs no introduction. Okay. And he's a 2013 TEDx speaker who shed light on personal vulnerability, leadership, innovation, and talent. Thank you very much for joining us, Myric.
Thank you, Alberto.
And today, they are joining us to reflect on the importance of enhancing trust, communication, and collectivism in this so very difficult times of COVID-19 that we're going through. So please join me in welcoming both Dr. Rosenfeld and Myric Polhemus. And so trust and communication are certainly really hot button issues today for meeting the challenges that we have. So Jason and Myric, if you don't mind, maybe we can get the ball rolling by getting your thoughts on the current state of affairs on this.
Sure. Yeah, well, I'd like to, if I might, start with just kind of a personal story and reflection. I think my wife, like many around us, have been trying to find outlets for exercise. And for many of us, that means running on the street because it's the safest thing that we can do. And I'm still amazed that today, that as I run through my neighborhood and see many more people out than normal, how oftentimes difficult it is to get people's attention and just do the simple nicety of a wave and a recognition of their existence and of my existence. And it takes me back all the way to when I was returning home from Ghana in West Africa as a US Peace Corps volunteer, where for 2 years, the expectation was that every single person that I passed in that village or in that town, I had to speak to, I had to greet, I had to go through the rituals of the greeting, which oftentimes could take 2 to 3 minutes just to get through. How is your mother? How is your father? How is the farm? And it became exhausting, but then it became so ingrained in my understanding of humanity and how we interacted with each other. And then the shock of returning home to begin working in Washington, D.C., where I could leave my house, get on the subway, go to my office, and come back, and all in that time span, not say hi or greet a single person. And I just reflect on that now and think, it's just such an interesting state that this is where we're at in the United States. And I feel like in many issues, this is just a microcosm of larger issues that we're kind of seeing. Myric, I don't know. What is that? How do you react to that?
Yeah. No, I think what's interesting about that story to me is I think each of us, as we go through our daily lives, can probably relate to that, right? Kind of walking through our neighborhood or going to the store, whatever it might be, where there's definitely a sense of isolation and a sense of disconnectedness to each other. Now, what's amazing about working in a retail environment is, there is a lot of opportunity for connection. I think we're fortunate to be able to do that. But I think when you think about on the interpersonal level, like you've described, Jason, and then you think about sort of the state of affairs that we're in today, where that's not just exacerbated one-on-one or even group to group. Well, it is group to group for sure, but group to group on a macro level. And that's really started to play out, I think, in a pretty extreme way that we really need to, I think, talk about deeply and try to figure out how do we reverse this as we try to figure out how to get out of kind of the current situation that we're in.
Yeah, and also, I mean, it's brought to mind many things for me, particularly within the world of healthcare, and how this potential mistrust and lack of willingness or inability to engage in dialogue just with each other is then further amplified within our healthcare system, where we have such inequalities and such disparities, where there seems to potentially be a disconnect, writ large, between our healthcare systems and the goals that system has, and the personal individual goals that every human, every American might have, where they're focused on wellness and thriving, whereas maybe our healthcare system is focused on profits and efficiency, and these things aren't jibing. And unfortunately, what I see from the healthcare perspective is that there's now this huge disconnect, and there's a growing chasm of trust and mistrust between particularly our communities of color, African Americans, Latinos, Latinas, and which then becomes evident in the enormous health disparities that we see across the United States.
Yeah, and I'm wondering, from your perspective, Jason. So, I imagine that is a situation that you had encountered in the past, I would think. But I mean, if you could speak a little bit more deeply, COVID-19 comes to the world. And what are you seeing in a combination of kind of the environment that you just described and a pandemic at the same time? Like, walk us through what that looks like.
Yeah, well, it's interesting because I've thought quite a lot about this since really we were hit over the head in February and March by the pandemic. I think we kind of hoped that we could be insulated from this, and clearly we've now learned that nobody can be insulated. As we know, viruses and diseases don't respect borders. And so the piece that's really kind of stuck with me is the lack of the lack of consistent and clear communication and potentially transparency from multiple levels of leadership, both political leadership and I would even say within our healthcare systems as well. And it's created this sense of mass confusion, but also creating even further and further mistrust within the system. And in fact, there was an interview with Dr. Fauci that was just released today where he lamented on this very issue of the growing mistrust within the general population of the healthcare system, healthcare leaders, and the public health system because of this fragmented communication and potential lack of transparency. And it's a challenging environment to work in. And if I can, I'll just kind of reflect about the potential impact of this. Now, this is going to be an extreme case, but I think it can shed light and understanding on what the implications of this lack of trust can lead to. And if we go back to the 2014 Ebola epidemic in West Africa, there were stories, and I forget the exact country, it was either Liberia or Sierra Leone, where some community health workers, outreach workers, were stoned to death by community members because that lack of trust between the community and the system leadership had grown so enormous, because the communities kept being told, you're not allowed to touch your loved ones and your family members once they've deceased. But that was such part and parcel of their culture and their norms that there became a growing anger because there was no dialogue with the communities about the why and the how do you integrate something new and something different into a cultural norm and a cultural value. And the result was this severe spasm of violence, which fortunately we haven't seen here in the United States, but I think we've seen similar kind of responses play out with mask wearing and reactions to social distancing.
Yeah. I mean, we certainly have experienced that from an HEB standpoint around multiple. I mean, so when you serve as many Texans as we do, and we are one of the few retailers that, regardless of sort of economics and sort of where you're coming from and parts of the city and parts of the state, like, we serve everybody. And what that does is that opens up an opportunity for us to kind of see a pretty wide slice of life. And we've experienced some of those same things, at least from the customers, in terms of differing levels of understanding as to sort of what to do and what not to do. And that's been a real challenge. That has been a real challenge from us from an external standpoint.
Well, and it's interesting because you can really do a side-by-side comparison. And in fact, my colleague, Dr. Bergeron, and I were teaching in our global health course for our second and third year medical students just yesterday about this very issue, the difference in leadership styles, and how if you compare New Zealand's pandemic experience to our pandemic experience, and you could put Germany there, you could put some other high income countries in that place, but the difference in terms of caseload, in case of mortality, is stark. First of all, but also the key piece that really, if you dig into it, for me at the very least, was consistent and strong communication about what is kind of expected of us collectively to do, that is clear, that is empathic, that is compassionate, but also transparency about exactly what is happening and why we need to do that. Whereas I feel like I don't think people would be too shocked to see this. I mean, from at least a national level in the United States, that consistency has not been there. I think we could also question that transparency. But I would say at a local level, at many of our local health departments, and even here in Bexar County, I think we've done a very good job of our public health leadership being very clear. Also, our political leadership, this is what is expected of us. But when you get that disconnect between kind of higher level conversations and lower level conversations, you end up in a situation where you have poor behavioral adoption and compliance. You end up with high disparities like the ones that we're already seeing that are amplifying the existing disparities that we've seen. And if you'll allow me just to give a couple of quick stats, and then I'll stop blathering about that. But we know that 20 of the 45 states for which we have data on demographics, that the impact in the Latino and the African American population is between, let me just find it, is up to 3 times higher than that of the rest of the communities. And so there's this high differential impact already happening. And I think that is a reflection in many cases of a lack of trust, and also a lack of real empathy from our leadership in terms of what our lower income communities, which predominantly are communities of color, what they're facing and how they're trying to navigate what is a very, very challenging situation.
Yeah, for sure. Yeah, and this is what is I think interesting, and that may be the wrong word. Is I think we all knew a lot of these fissures existed. If you are watching documentaries on Netflix as an example, sort of some of the conditions with which some of these ecosystems from a communication standpoint have really impacted our ability to communicate and bridge that divide. But when I hear you talking about sort of transparency, trust, understanding things like culture and difference, lack of dialogue, lack of communication within sort of an empathic and sort of compassionate sort of vein, I think this is what's needed. I mean, I think that we need to have a much deeper dialogue as to how do you transition from a situation that we're in today, which is definitely a lack of connection, a lack of empathy, lack of compassion, into something that's a little bit more around those tenets. And, I think that this is the real mission in my mind as to how it is that we need to start kind of getting into this. Now, I would say, and Jason, we can talk a little bit about this on a little bit more. You've got really kind of 2 major dimensions though here. You've got what do you do as an individual, and how do you sort of participate in this mission of compassion, empathy, listening, understanding, humility, and then as an organization, what do you do? As an organization, how do you take action in order to kind of help us get to a little bit different place as well?
Yeah.
I'm sorry, if I may just quickly jump in. There's a question that I think is interesting at this point, and it's the question is the lack of trust a byproduct of a lack of clear communication with patients? And I would even add, or is there a even higher level lack of communication even with communities? Do you think? Because for what you've been saying, I think it's even at that level.
I'll start us off here. And when we were kind of first starting this conversation about how we wanted to talk about it, I think we had a long list of all the whys. And then we realized, well, that's a whole conversation in of itself. And so we tried to kind of keep the whys to a minimum. But if I can go a little bit back into history, if we're looking at it at least within the healthcare system first, there are so many examples of the disconnect between our healthcare system and particularly our communities of color, which have led to high levels of mistrust and poor communication. I mean, you can look all the way back to the Tuskegee syphilis study and how, the Black airmen were not informed that they were being infected with syphilis and there was no treatment for it. You can look at like the impact on the Latino community and the immigrant community and how they're not willing to go to healthcare facilities because of the fear of being deported when they are known to, when they're identified as not having documentation. And so these are kind of at a macrocosm of what has kind of led us to continue widening gulf, but at a smaller level, to the question that was just asked from one of the from one of the viewers is, I'm not a clinician, so I can't speak to it directly from that perspective, but I train future clinicians, and I can tell you that there oftentimes still is a patrimonial perspective from our healthcare systems that we know better, that we know what to do, and you just need to listen to us. But it ignores the fact that people have lived experiences, and that it also oftentimes we ignore the fact that our health is determined by more than just the access that we have to the healthcare system itself, that it's determined by our housing, by our environment, by the streets on which we live and where we work. And oftentimes our providers, we're getting better about this, but oftentimes our providers either ignore it or are unable to unpack those social determinants of health and dive into the cultural factors that may be limiting one's ability to adhere to a certain regime. And then we end up with patient shaming and saying, well, they're lazy and they're non-compliant.
Yeah, and then one of the, Jason, I mean, you and I have talked about this quite a bit, and when I think about communication, there certainly is kind of just relaying information, from one direction to the next. But I think that when you think about communication a little bit more as a sort of a holistic process, it goes into exactly what you're referring to, which is, how do I, as the expert, get into sort of a dialogue with an individual who might not necessarily know what I know in the sphere of my expertise, but certainly they bring a perspective and an expertise in terms of their own existence and their own experience, etc. And how do we start humbling ourselves to have that conversation? Because the communication is only so good as the connection to the individual or the connection to the community or the connection to sort of society at large in order for us to really have a dialogue. But it's also about me reducing that ego a little bit and getting in and really seeking to understand. But of course, I have a message to deliver, but I'm not here to just deliver that message. I'm here to connect with you in order to understand you so that I can best deliver my message that is most relevant to you, right? And tailor that in whatever way I need to.
Right.
Or even learn something and know that the message is not the right message. Right. So even going in with that level of humility to say, yeah, I've got a thing to deliver to you from an information standpoint, but it might not actually turn out to be the thing that you need.
Right.
And being okay with that.
So Jason and Myric, this is fascinating. And there's another question that I think you just kind of answered, but I just want to make sure that is the answer. Okay. And the question, I think, is a very good question. It says, if administrators, healthcare business owners, business owners, corporate leaders, etc., know that these issues exist, or they are aware that they exist prior, what has been preventing addressing these issues previously? Building change and progress solutions to address these issues, and how do we generate as lay people, employees, patients, community members to try to move things forward? So you were mentioning a little bit about ego and lack of humility. Would you say that people were aware of these things already, and there was no movement forward because of that?
Well, first off, there's a lot in that question. Jason, you wanna take a first crack at it, and I'll see what I can do.
Yeah, I mean, I'll speak in broad brushstrokes. I mean, I know that generalizations are always dangerous, but I'll go ahead and put my toe into it. And then also with the understanding that, you know, our hope is to bring this conversation to some specific solutions that you and I have kind of come to. But, you know, from the healthcare perspective, I would say, yes, we're aware of it. And I think, you know, you could argue that some are more aware than others, but there is a strong focus on understanding the social determinants of health and really trying to train our healthcare providers, not just our physicians, but our nurses, our health auxiliary workers, our community health workers, to really understand that people are more than the illness that they present to a hospital or to a clinic with, and that they have lived experience, and that there is a reason why they have that illness. And so we have to try to unpack that. The challenge is that, unfortunately, I think, at least from my perspective, the system is not set up to allow us to engage in those conversations more effectively, nor to begin to address them as part of our understanding of holistic health and well-being. Where as healthcare providers, we focus on health. But health is everything. It's our nutrition, it's our streets, it's our housing. And so we have to broaden our understanding of that and figure out ways of integrating our healthcare system into a larger system. So that's my kind of short answer to that. Myric, what are your thoughts?
Yeah, I would actually add two things. The first one is what you just referred to, which is, how do you take a much more holistic view of what are the outcomes you're looking for? So, and Jason, you're an expert in this space, so I'll just make a comment. You can validate whether this comment is true, or at least mostly true. Is if you're working in a system that is not necessarily rewarding the practitioners for the well-being of the patient, and that is the ability to spend the right amount of time, the ability to prescribe the right thing, whatever it might be, whatever those mechanisms are, it's very unlikely you're going to get the outcome you're looking for. So the first question is if you take a holistic view, but you're only measuring it in a very narrow slice of what we determine success to be, then it's most likely that you're going to hit that success factor, but that one success factor might not necessarily garner you the impact you're looking for. Mm-hmm. I think that's the first point. I'll let you respond to that, and then I'll get my second point out here in a second.
I think you're right. And again, like, it's not that people have been aware and not trying to change things, right? I mean, there's a big push within the healthcare sector now on patient-centered outcomes, which is really just a fancy way of saying, you know, what are the outcomes that are more than just cost and efficiency, but actually wellness and improved health outcomes, or anthropometric measurements, or our screening tools like A1C, or our hypertension levels, or more importantly, readmission levels, right? So like, what is the time for somebody to kind of be readmitted into a clinic or a hospital? So we're moving in that direction, but you know, one way that I would phrase this and think about it is, we're kind of reverse engineering all of this into a system that wasn't really designed in the first place to focus on health and well-being. It was to focus on profits and efficiencies. And so it's still challenging, because it feels like we're trying to maybe squeeze a square peg into a round hole. But we are trying. There are efforts, and the ACA was another, the Affordable Care Act was another way that our system is attempting to make these changes and focus more on the individual and what matters to them.
Yeah, I think I appreciate that. I think that gives good color to the comment. The second point that I would make is we cannot, I think, so from a leadership development standpoint, or a skill development standpoint, when we think about really shifting the practitioner's focus from, you know, them being the center of expertise to them being a participant in a larger conversation in order to drive a health outcome that has people at the center, you cannot underestimate how difficult that is to have that paradigm shift. And so, you know, whatever skill building needs to be done, whatever leadership sort of mechanisms need to be done, whatever communication and change management, and there's just so many layers there, especially within a system that doesn't necessarily, enhance that. That is very hard to do. I mean, I can tell you from my own personal perspective, we have communicated, like at HEB, I think we do a relatively good job of communicating internally, and I still have to teach 1,000 people every year on communication techniques. And they've been through a lot of these classes before. So this is something that you have to work on constantly.
Yeah.
It is a lifelong skill. And if you have a class or a course, or you watch a 15-minute video, you've only scratched the surface. So the skill building that you're talking about, to have this more holistic approach, to have that ability to connect, is a really big challenge.
And one other piece I just want to quickly add to that, and it's something that's been knocking around in my head for the last few months, is this idea of reflexivity, and really the individual being able to reflect upon themselves and one, how are they engaging with the world around them, but also how are they trying to challenge their preconceived notions, the way that they bring their own potential biases or otherwise to their work, whether it's within healthcare or otherwise. I think that's just a general lesson that we as humans need to kind of keep leaning back into, is taking a look at ourselves every now and then.
Yeah. And this is going to be slightly off topic, but Alberto will keep us on track here. One of the things I'm studying pretty deeply right now is ego and ego development, and specifically the techniques of reflection, and the techniques of really kind of taking a step back and having an accurate or an honest account of your impact, sort of beyond yourself. The healthcare system doesn't necessarily isn't built that way philosophically. I will tell you, the private sector retail industry is also not built that way, right? So we are in a for-profit model that also drives efficiency, also drives how is it that you kind of continue to grow your business, et cetera. And reflexivity, I think is what you called it, is not in that recipe. But I think it needs to be. I think this is as we think about having a more holistic view of what success measures you need to think about, specifically to drive connection, specifically to build trust, the ability and the time and the space to reflect and have an honest accounting of sort of what your impact is, I think is critical. And I think it's a skill that, especially here in the United States, we don't necessarily practice a whole heck of a lot or put a lot of importance on.
Yeah.
So if I may, in response to that great question of what you said, I think that what I get from what you guys are saying, which is amazing, is that it's not just a question of being aware, but we're also facing deep structural issues. The way things are actually designed, the way the organizations themselves are structured, and also taking for granted things like communication, like Myric was saying, we communicate all day long. I have a great comment here that says, funny how we communicate all day long, and yet we're still not good at it. So would you say that's fair? I mean, it's also not just awareness, deep structural issues, and also taking some things for granted, and we shouldn't.
Yeah, I think all those are in play here. So you've got for those of you who want to continue to sort of explore this topic, I would recommend, at least as a primer, The Infinite Game by Simon Sinek. And the reason I say that is one of the central tenets there is, our system, for the most part in the United States, is built off of maximizing shareholder value. And if that is your primary goal, if not exclusive goal in a lot of cases, then you're going to do that. You're probably going to do that relatively well, but you're going to miss all these other measurements of sort of effectiveness, long-term, relevancy, and the happiness and the happiness and well-being of the employees that you have, et cetera. So I think structurally, for sure. I think the other thing too is we seem to talk at each other quite a bit, and I think that we feel like that's doing the trick, right? As long as I tell you, Alberto, sort of what my opinion is, and we cut it off at that, I feel great. The reality of it is that's not a conversation, and that's not a dialogue, and that's not how we actually move this forward. But we do a wonderful job of talking at each other. And if you need any proof of that, turn on any cable network show. That's not a conversation. those individuals are not having a conversation. They are reciting talking points that they want to get out, and it is a faux conversation. But unfortunately, that's what's being modeled for everybody in terms of, oh, I guess that's what it takes. That is what it looks like to conversate. And I think we really need to completely redefine and reestablish what a real conversation looks like.
And if I might just quickly add to it, and I think you've said this, but I'll just say it explicitly. A conversation is more than just me talking, but it's also the listening piece of it. We forget that communication is both of those.
Yeah.
And effective communication is where one is actually listening to what the other is saying and not just waiting for their opportunity to talk.
Yeah.
And then I will just further say, without with full disclosure, that I am not a social media person, and it's probably because of this very reason, which is exactly what you just said, is that we live in a world of hyper social media where a conversation now is simply posting something against a wall where you can hide in your anonymity and feel like you can say anything, and there is no dialogue. I remember thinking when I first started trying to create a Facebook group for the work I do here at the university, I was like, oh, it's going to be great. It's going to be this platform for engaged dialogue. We'll post content and people will have witty banter and really insightful things. No. And then finally somebody told me that's not what happens on social media. And I was like, oh, you're right. And so I think we've just kind of we've gone to the extremes, unfortunately, in that world. And in many cases, that world has now come out into the real world where we feel empowered to not listen. We feel unwilling to not engage in dialogue, but to actually just literally hammer our point and say, well, that's it.
Yeah, and let me bring it back down, or back to the individual and the organization. That happens at both of those levels. So this is not a condemnation, like everybody just needs to behave differently. This is I think far more systemic, and in our organizations mimic a lot of the times this type of behavior. There's a reason why the public has trust issues, right? And so it's not that each organization comes in with a level of sort of compassion, etc. Now, there are a lot that do, so I don't want to say that doesn't happen, but there is this vicious sort of thing where individually we're doing this, but organizationally we're doing this as well, and that's a real bear, because you end up not having a good example out there to say who's actually doing this well, or at least well enough that we can learn from it.
Mm-hmm. Yeah. Anything else from the crowd?
Yeah, well, there are a couple of really good comments. One actually from somebody apparently from the health sector. It says the paradigm shift is so difficult because of perverse incentives. Mm-hmm. We need to pay for outcomes, not fees for services. And the letter is why will simply cause us to build more hospitals. It says we need to stop building hospitals where diabetics get their amputations instead of investing in community health, education, coaching, facilitating, incentivizing wellness in our community.
Yeah.
That's a great comment right there. Yeah.
Well, if I might, I wanted to kind of move us into this conversation about where we've seen some potential solutions. And first, I wanted to kind of come back to this kind of current event and, my reflection as a citizen of San Antonio and a consumer at HEB. I wanted to just kind of reflect that I've noticed that HEB seems to have navigated the pandemic first quite successfully. And I know, because I've got an insider in my house who works for HEB, that HEB, nationally was one of the only companies that actually had a pandemic preparedness plan in place that could be activated. I was hoping maybe you could talk a little bit about how and why you think HEB was so well positioned for these current situations.
Yeah. That's a great question, Jason. And I don't know how much everybody knows, so I'll give a little bit of background on this. I won't get into it too deeply because we don't have that kind of time. But there's a couple of tenets this is built on. And the first tenet is HEB is truly a part of the community, and each store is very much tailored to that community, and that is a choice that HEB has made. And the reason that is because we know sort of each store behaves a little bit differently based on sort of where it is and who shops it, etc. Now, if you take that philosophy of really trying to be a member and an active member and a contributing member of the community that way, not just from a store standpoint, but as a participant standpoint, and then you think back to hurricanes that we've had in the past, HEB has really worked incredibly hard to be able to help those communities recover. And the reason we've done that is because we have a sincere, deep bond with the customers that shop with us and the people who work with us. So our partners, which is what we call our employees, we have a real connection and a real commitment to them that has nothing to do with sort of the dollars and cents. Now, certainly there is a benefit to kind of having that philosophy, but that's not the philosophy. The philosophy is to contribute. The philosophy is to have a deep connection and a deep commitment. And so all of the decisions that HEB makes are really people-centered, and whether that be community and or whether that be the people that work for us. Now, in that, we also, I think, do a relatively decent job of approaching most issues with a pretty humble frame, which means we're here to learn, we're here to understand, and we're here to try to get the best out of whatever the situation is as we can. So that's all the setup for. Because we had such great relationships with our suppliers, because we had such good connections in China and in South Korea and sort of globally, we actually heard about a lot of what was going on with the population and with the retailers well before it hit the news. So I think you've got to go in with a mindset, right, that we don't know it, we don't understand, and we're here to learn from who is sort of experiencing the things they're experiencing, not just here in Texas, but in the world. And so as we have these connections across Asia and we see what's going on in Europe, and we're learning from what's going on with our peers and our relationships we have there, it was clear to HEB in January that this was coming to the United States. And in fact, we have many individuals internally that said it's not a matter of if, it's a matter of when. And the question is what do you want to do? So who do you want to be? Do you want to be someone who protects the individuals that work for you? Do you want to be a safe harbor for customers and community to enter and know that they're going to have an experience that hopefully meets their needs, and at least if nothing else, is some level of sanity in all of this sort of insane kind of environment? Now, that doesn't mean we did everything correctly. I mean, we definitely had our challenges. This was unprecedented, even by just learning, as far in advance as we did. But we did a lot very, very quickly and very, very well. And overall, our response was great. But it's all predicated on we listen, we learn, we come in, and we're not the experts. We are not the individuals that are going to tell the community what to do. We're going to work with community. We're going to work with customers. We're going to work with our partners to truly get a sense of what is it that we need to do to respond. And that's not built overnight. That's something that you have to build over decades to really do it and do it well. So I'm proud of us, even in some of the challenging times. But that, Jason, is really kind of the key to how it was, how our response was, seemingly as swift as it was. And in relation to most, it was pretty slow.
As a regional grocery store chain, I just wanted to point that out.
Just to be clear, we're only in Texas and Mexico. So if we figure this out, you can make whatever conclusions you want to on that.
Absolutely. But, we all are so proud of HEB, and everybody admires the response. And it was about listening, like you said, listening and paying attention, being part of the community. Yeah. So, this is some great thoughts here, but I would like to ask, so what are your thoughts on how do we go from here? What would be some of the things that we should be looking at doing as a community, as institutions and organizations? What can we learn from success stories like HEB or from challenges that we've been having? Your thoughts on that? What are the next steps? How do you see it going forward?
You want me to take a crack at that, Jason?
Yeah, I mean, what I'd like to do is, I mean, I really love the pieces that you were just describing. You know, I wrote a couple of things down. Each store is tailored to the community because you're a member of that community, and the decisions that are made are people-centered decisions, right? I think this is really at the heart of, in my mind, of what makes HEB tick and be such valuable members of our community. Just real quick, so my wife is originally from San Antonio, and she and her family used to always talk about HEB, 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 and I was like, I don't understand how people can have a love affair with their grocery store. That was until I moved to San Antonio and I began shopping at HEB, and now I have drunk the Kool-Aid, and it's because of that sense of I matter, not just as somebody who's buying products and giving a profit to you as a grocery store, but I feel like I am a part of this community and you are the same part of that community. And I think that is a key lesson that all of us can learn. And it's hard. Like you said, it's not that you just flipped a switch and one day HEB was this way. I would venture to guess that there was some sort of, there's some principles there, there's some mission there, and some training there. And if you wouldn't mind, maybe just kind of delve a little bit into that, and then I'd like to riff off of that into how we can maybe learn and apply it in the healthcare setting.
Yeah, so I think you're right on. So if we take a step back and we say, okay, from an individual level and organizational level, what could be gleaned out of this? I think the first one is, Jason, number one, how sound are the principles that an organization not just espouses, but actually lives into? I mean, everybody probably has examples of, you know, slogans and mottos on office walls and, you know, conference rooms, and that's a thing that you can do, and I think it's a thing that to kind of reinforce it. But the more important thing is to actually live that sort of mantra. So just as an example, our slogan internally is we are here to make the lives of Texans better. We are not here to sell groceries. We are not here to, give fresh product, low prices. We do all that for sure. Like, that is kind of part of the business model. But the goal is to make the lives of Texans better. However we need to do that. So whatever we need to do to make that happen. So the question is whatever organization anybody's a part of, do you have people at the center of your decision-making process? And when that decision is not going to foster connection, something like making the lives of Texans better, then it's probably not the decision that you need to make. And I think the other thing too is, Jason, that one of the things I love about working for HEB is we don't make these decisions as like pure trade-offs. So this is not, I can either be really good to people or I can make money. And I think a lot of people also look at that from a binary standpoint, like it's an either or. And what I would tell you, it's a this and that. And I think that's the other thing too, within HEB and within kind of our philosophy, it really is you can accomplish a lot more things than you think you can. And you can drive, really good sales and connect with people and pay people well. And you could do all those things. That is a strategic choice, but it's a strategic choice because people are at the absolute center of the decision-making process. And so I think being highly principled, living those principles, and then really having people at the center. We talked a little bit about this, right? Connection, listening, humility. I've talked about vulnerability in the past. I'll talk about it here again. Like, how do you sort of open yourself up to be vulnerable? So I think in my mind, there's a lot to be learned there, because I do think that it could potentially be a model to look into and try to emulate both personally and organizationally, which I hope would be helpful. I think one of the things I've been reflecting on actually is, and I appreciate the accolades. I think what I really hope is that this becomes not an outlier, but something that's pretty standard fare for organizations to do. That's my hope.
Yeah, and I love that that's the the internal mission. And I mean, I know UT Health San Antonio, we make lives better. That's what we're here for. And we do it through a variety of different ways. And I think that's what has kept me, and I know it's what's kept me here for so long, is this ability to impact health and well-being across San Antonio and South Texas through multiple channels of training the next generation of healthcare providers, but also being given the opportunity and the space to pursue what I'm learning about what works in terms of community health. And that's what I'd like to just quickly share some of the perspectives of what we've been doing, trying to bring principles of what we call community-based participatory research, which is this framework of community-engaged dialogue that was started in the early 1900s. Paulo Freire, the father of adult participatory empowerment education, was a big part of this whole concept of change happens from within communities. And so we need to go to the communities that are most vulnerable, that are most underserved, to listen, first of all, hear what they're saying, help to co-create knowledge, right? Because there are many ways of knowing. There's books, ways of knowing. You know, I've got a doctorate now, and that way of knowing is one way of knowing. And there's folks on the south side of San Antonio who maybe have a primary school education, but we don't discount what they know, because they've lived a life and they have experience and they have knowledge that comes from that. And as you mentioned, we have to put our ego oftentimes aside as health professionals to go in and understand and respect that way of knowing, and then try to integrate along with them, that community, whomever it might be, how we can bring new ways of knowing into that current context to build off of the experience using people like community health workers. Yeah, Alberto.
Yeah, Jason, I just wanted, because we're kind of, the time is just flying by, you know. To maybe we have like 5 more minutes or 10 more minutes before we close with some additional questions and comments from everybody listening. What would you say are some like more operational considerations in moving forward? Some ways in which you can think about actually applying all these great lessons and the great things that we've been hearing to, as a community here in San Antonio and Texas, moving forward and improving this communication and collaboration and more collectivism.
Well, so I think, you know, from my perspective, from a health and well-being perspective, what we've been doing as the Center for Medical Humanities and Ethics here at UT Health San Antonio, along with our partners down in the Lower Rio Grande Valley, and we're now taking lessons from that initiative with the Community Health Club. So this is what I spent my TED Talk talking about, the model as it was of a community-engaged education, creating peer groups for co-knowledge creation, but also peer support and social support to achieve behavior change and collective action. There's documentation of the impact of that across Africa. We successfully brought the first adaptation of that intervention to the Lower Rio Grande Valley and Brownsville over the last 2 years. And we've now had consistent engagement with about 4 clubs of around 50 to 60, both men and women, but predominantly women, who are learning together, but also importantly, taking action together and offering social support. I offer this as a potential model because what's happening is it's resonating with people, because what we're doing is we're listening. It's this foundation of community-based participatory research where my job is not to tell people what to do, but to listen to what they are saying, provide new ways of thinking about facts and information that can be blended in with their existing knowledge and practices. So for example, we did a nutrition and physical activity curriculum. All of our practical cooking sessions, because there has to be praxis, there has to be actual doing to be able to achieve behavior change, was focused on recipes that people already knew. Pozole, making tortillas using applesauce instead of lard. And so these are real simple things, but until people are given the challenge to try something new, they don't necessarily do it. And unless there's the social support around it to be able to allow them to take a risk, to fail and or succeed, then it won't achieve. And so this is a model that we're finding is working. We're bringing that model now here to San Antonio in collaboration with the Metropolitan Health Department in direct response to COVID right now. We've got some peer groups, hopefully, going out the door in the next couple of weeks to help people process what is it that we're asking them to do as public health professionals. How do you manage your own personal risk and still live your life, because we're going to have to find a way to live our lives with this virus for at the least the next 6 months, if not full year, before a virus is, or before a vaccine is fully available and deployed into the public. So that is just one experience from my world, where, you know, we've brought a model that is very much based in this concept of listening, of compassion, of humility from the healthcare provider or the expert, as it were, that is now resonating and hopefully being replicated across Texas.
Yeah, and the thing is, Jason, is you know, COVID-19 you know, has exacerbated this, or at least highlighted it. The reality of it is we'll face things in the future that will also continue to highlight this if we don't take action. You know, I'll share a few. You know, it's going to sound somewhat repetitive to what Jason talked about, but here's what I would challenge everybody to think about. So as we go through this, and you think, gosh, this is really remedial. Listening, okay, yeah, got it. Compassion, sure, got it. My question to you is, anybody who's listening, if you really write these down, and you can find examples of this, either with people that you're working with, organizations that you're in, and you can honestly say this is happening, I would imagine these examples would not be as plentiful as you'd like them to be. And so really, it again is a bit elementary, but I think that's part of the challenge, is we have forgotten or discarded, or whatever it might be, some of the things that sound easy, but are actually incredibly hard to do, and underestimated how difficult this is to do. So a couple of things that I would say is, number one, you're always going to, you're most likely going to hit the measurements that you choose to measure. And the question I would have for everybody is, are those measurements holistic? Are they people-centered? Is it very, very narrow in terms of defining a very specific thing in someone's life or existence or business, et cetera? And I would say broaden that as much as you possibly can in order to think more holistically about what success looks like. What you'll find is so one of the things that you just mentioned, right, like the cooking classes, et cetera, that takes time. Right, there's an investment there, and what you're going to find as you, I think, uncover that and say, how do I measure this differently? How do I think about this differently? Time, attention, commitment to these things is really going to start becoming quite a challenge and quite a barrier. But don't let that stop you, because I think that that's where the goodness is. The second one is listen with intention to learn and seek understanding. I think most of us go in as an expert in whatever field we're in. We have a tendency to think that expertise sort of radiates beyond the expertise that we currently have. And the reality of it is our expertise is limited within the domain of expertise. We might know a little bit about the thing that we're talking to somebody about, but you probably don't know as much as you might believe that you do. And go in with that level of humility. Go in with that mindset of, I'm here to learn. There's something here that is valuable for me. Which does bring us into humility. And then the last one is, how many decisions do either you make as an individual or your organization makes as an organization that is truly people-centric, that is driving results in a way that is raising sort of people's well-being, however you want to define that. And most of the time, the systems and models that we live under aren't necessarily geared to do that. And again, if you really think about that completely and you really dive into what would it take for me to be able to do that, you're going to uncover some really interesting, I think, things that will help you discover more specifically what to do in order to accomplish this. Because ultimately, our goal is create listening, understanding, compassion. Doing that at an individual level, I think, creates trust, which bleeds upward. And then if you're an organization and you're really trying to engage the community, engage kind of a broader collection of individuals, do it with transparency, do it with good faith. And I think you'll see, if you get it from both of those ends, we'll start to make some level of progress. But it's going to take everybody to really dive in and think about this deeply and commit to these principles in order for us to not repeat what we're currently going through.
I completely agree.
And I think that's a huge conversation to have as a community, as a society. Even in cultural anthropology, what they tell you is you might be an expert in culture, but you're never an expert on a specific culture. So when you get in there, you need to first of all have somebody from within the culture that's going to help you understand and translate and really learn. So you have to have that humility, like you both are saying.
Right.
And I think that's something that every professional, an expert in their own field, has to learn, right? I mean, I might be an expert in this field, but I'm not an expert in everything else.
And just real quick off of that piece, the piece I've been thinking about as you were talking, Myric, and I know you said this, I'll just say it in a slightly different way. My wife has been talking to me a lot about crucial conversations and this idea of why are you going into the conversation and what are you hoping to do? If you're going in to win the conversation, then you've already lost. And I feel like that's oftentimes where we are, both within healthcare as well as just in general, that my goal is to change your mind about whatever it is. If we go in there, then it's not going to work. But if we go in with, as you said, with this learner's mentality of this humility of what I don't know about you as a person, and have that willingness to be vulnerable and to say, okay, I'd like to learn, then you'll find that we can begin to have these conversations. And as you said, trust can begin to be built. And so I challenge all of us to, again, challenge your own preconceived notions about the person sitting across from you and what you think they know. And just go in with that kind of child's innocence to a conversation and just wanting to learn.
Yeah, and so I think that's excellent. And the one thing that I would say is if you're in a system that's winner take all, zero sum, winners and losers, like from a systemic standpoint, it's really hard to take that mindset. I think both individually and as a business, it's reinforced constantly of winning, and winning is great, but that shouldn't be the only goal.
Yeah. And we got like 5 more minutes, so I'd like just to go over this. So in short, we've been talking about how this is also very structural. The issues are very structural, not just a question of awareness. It's a question of the metrics we're using to see if we have the right metrics. So far, so good. And also a question of being able to have more humility, understand that anybody who's an expert is an expert in one thing, not necessarily in everything, and you need to have more of a more people-centered and open and understanding that you need to learn from others, and more about going within the community. I think that people would be fascinated, Jason, about learning more about the community-engaged education and everything that you're doing at the center. I think that's a great movement. And so getting the right measurements, making sure we're measuring the right things for what we need to achieve or want to achieve. That good. Then, of course, being able to put in the time, attention, and commitment, and having that discipline and listen. That's a lot.
Yeah. We just need to do all that, and I think
it'll be fine.
Everything will be fine.
So, well, these are some of the key points, and I hope that we can get more of this conversation going with all the key stakeholders in our communities. Because I put these things at the center because I think there's not enough not enough conversation on how we can have a good conversation.
Yeah.
I think.
And just to boil it down, I mean, just meet people where they are, not where you want them to be. And if you go in that way, then we can have any successful conversation.
Yeah.
And can I ask you a question? Are there any kind of initiatives where all these dots, like what you're doing at the center, Jason, what you're all sharing and the examples that you're setting, Myric, is there any place where these dots are connecting with each other so far?
Oh, in terms of the health space and
in terms of community growth and maybe that community change, like a place where people from private and public, because right now it's beautiful. We got private and health sector talking together, and there are things to learn from both and from each other. Is there any kind of conversations happening anywhere where you have all these actors talking about this precisely, or not? Right now.
Well, I'll just say, from an HEB standpoint, one of the things that we not just encourage, but I think that's kind of built into who we are. Each of us are involved in the community in some sort of way, and so that goes from our CEO all the way down. I mean, I sit on multiple boards and represent this perspective quite a bit. We do things like this. So we have a relatively large presence, and we've got hundreds of HEB leaders out there that are really trying to drive this message of connection and community in a more holistic, approach to not just business, but kind of like an organizational, commitment to the greater good.
And I can just tell you, I mean, our program in the Valley that I was just describing with food and nutrition, HEB was a part of that. We had dietitians from the local stores that were doing store tours and education with our members. And in fact, we just did a virtual one with those same nutritionists and dietitians, and it was amazing. So that's a micro example, but there are lots of examples of what we kind of call collective impact within the public health world of business and public and universities piling in together to really get a larger impact on development.
Outstanding. Well, I'd just like to close by saying that if anybody who's listening, or for those who are going to be watching this live stream or later on watching the recording, I think that if they're interested in taking some of these lessons into their own organizations, whether public or private, I think they might be able to reach out with you guys and talk about this and see how they can learn from what you guys are doing. And I'd like to just close by mentioning some of the comments that we've had. Okay, very quickly, and I think we cover them. One is saying human-centered organizations finding the synergies between business goals and customer and employee needs, which is what Myric was talking just about right now. And here's an interesting question: is HEB looking at where the food deserts are located, and would they consider proactively marketing and putting fresh produce within each one of those communities? And I think we got like 1 minute for that one.
Yeah, and that's one that so that would be me wading out of my expertise. So what I will say is we try to serve every single community we possibly can, and many of our stores are located in places that there are no other retailers because we don't want to create food deserts.
Okay, great. And here I got somebody from actually the Medical Humanities and Ethics Committee saying that there's a community service learning conference coming up, and that the next CSL conference is on February 5 and 6, and everybody's invited. So we'll put that out there. Okay.
Yeah, that's a great program run by my colleague Melanie Stone. So
we'll put that information out there, and somebody has a great conversation with some really good takeaways. Thank you all, and I really do thank you guys. You've been amazing, and some great takeaways. And we're going to put this up in the web, and hopefully we can listen to more of what you're saying, because it's so important. Your message is so important, and we need to do this moving forward. I don't think it's just the COVID. I think it's moving forward as a society, so we can grow in the future. So, and again, any final words before we close? Anything else?
No, I've really enjoyed this, and the time has flown by.
Mm-hmm.
So I'll just have to do this for a couple more hours. But Jason, I really appreciate the conversation today.
Yeah, thank you for joining me, Myric. It's been a lot of fun.
Yeah, thank you both, and everybody else. Thank you for joining us and for your participation. And we hope you join us for the next Red Dot. And this is Alberto Garcia Jurado. Thank you, everybody.
Thank you, Alberto.
Great talk. Thank you.
Thank you, everyone.
All right, bye.